Hey guys, thanks for stopping in. If you're wondering what this is, when I woke up this morning I realized it's been 5 years today since I had open heart surgery. So what ended up happening was I had a heart valve replacement. I got really sick and I got endocarditis. It's actually the second time in my life that it happened, and they don't really know what caused it. They think I may have just been born with a faulty heart valve, and it kind of picks up bacteria. So anyway, they never really did know the cause. So exactly 5 years today I had the surgery. I was actually in the hospital on antibiotics for about 11 days before they could actually do the surgery because I was so sick. The doctor said, well, we have to get him healthier before we can even operate, because if we try to do it now he'll just die in the surgery. So they had to get me healthy enough, and also he said that my heart, the infection around my heart valve was so bad that if they tried to attach a new heart valve it might not hold. It would, just because the tissue was so unhealthy. So they ended up using a pig valve rather than a mechanical valve, because since I have back problems, if you have a mechanical valve, you have to be on blood thinners, and they're like, well, if you may have to have back surgery in the future, blood thinners would not be good. We better use a pig valve. The only bad thing about a pig valve is they say I may outlive that. So that's the bad thing. So how do I feel since then? Well, actually pretty good, but it took a long time. Probably took like a year to recover from it. I was just really tired and exhausted all the time. And people ask questions about like the scar, if that hurt. The scar goes like from here all the way up. And that really didn't hurt so much as my upper back muscles, because they open you up, and all those upper back muscles were really really tight and painful after, because they're just stretched. And I have thoracic outlet syndrome, so I'm tight anyway, so I was worried that it might make that worse. The doctors didn't seem to think that it would, but I really didn't have much choice anyway. So but the one thing that did happen is I didn't have any strength in my left arm for a couple months after. I could hardly grip anything with it, and that was kind of scary, but the strength finally came back in that. What else? I did a lot of vacuum cupping on this scar once it was pretty well healed, and that was extremely painful in the beginning, but what that did is it helped soften it up, and it helped it fade a lot. It faded a lot from the vacuum cupping, so vacuum cupping is good for that. What else? I'm trying to think, for anybody that's going to undergo heart surgery, what else would they be asking? I think that pretty much covers it. Once I had the surgery, I think I was in a hospital about 5 or 6 more days. I think it was a total of 17 days. And once you have the surgery, you're in intensive care, so that kind of was not too neat. And the bad thing I remember the most is I couldn't sleep, because every time I lay down, I had fluid in my lungs, all this liquid and phlegm and stuff. So every time I would lay down, I would start coughing, and you start coughing this stuff up, and you always have to be carrying around paper towels, and you have to be always spitting this stuff up. It's like probably for a good month after the surgery I had that. Oh yeah, and then the other thing, I had to have a PICC line that went in my arm all the way up here to my heart, and I had to be on IV antibiotics for, I'm thinking it was probably a couple months after. A nurse actually had to come to my house, a couple times a week or once a week or whatever it was, I can't remember, and look at me, and then they would there was a company that would ship me medicine every 3-4 days, and you have these automatic pumps that pump it into you, and I think some of it you have to shoot in with a syringe, if I remember right. But anyway, you have to change the medication like once a day, and it's a big hassle. I mean, it was actually a pretty big ordeal. So actually feeling pretty good now. It's like I said, it's like 5 years ago today I thought of that when I got up this morning. Actually, this pillow was up in the closet. I kind of started thinking I was going to do this video, and I asked my wife, I said, did we still have that heart pillow? I had to carry this around with me when I would walk. And also too, you cough all the time because you're coughing, like I said, you're coughing up all that stuff that's coming up out of your lungs. And every time you cough, you have to pull this in tight to your chest because you're so sore here. Kind of helps with that, and also kind of protects the scar and holds it in so you're not, you know, breaking open your stitches or anything. It's kind of a big ordeal. But actually, the date is actually written right on the pillow right here, February 28th, 2012. So actually, I pulled this out, started getting a little emotional when I was dusting this off, because that was a pretty big ordeal. In fact, a lot of people, even my doctors, they weren't sure if I was going to live or not. In fact, my wife told me afterwards that whole floor, the cardiac unit, they would have a big meeting about me every morning. You know, it seemed like there was nurses taking care of me like 24/7. I mean, they were always doing something, you know, giving me some kind of antibiotics or putting in IVs or taking out IVs or checking this or that. It was a huge ordeal. So making this video is just kind of my way of paying it back. And it's like from a patient's point of view. If you look, a lot of stuff you see on the internet about health, like that I do, it's coming from a doctor's point of view or a therapist. So everything I do is from my point of view, the patient's point of view, the patient's perspective. So I figure, you know, it may help someone else that's going to have heart surgery and go through it. So I know I would like to see videos like this if I was going to have to go through that. So just thought I would do that. Thanks for watching, you guys. Talk to you next time.